Hello MTV, welcome to my crib. So what we're going to be doing today is going through a couple of skill checks. So this is my lovely assistant. Say hello, lovely assistant.
Hi, lovely assistant.
There we go. So the first thing we're going to be doing is talking about moving a patient in bed. So we're going to start off with just using a draw sheet, which this lovely towel, say hi towel.
Hi, towel.
Will be performing the role of the draw sheet. And then we're also going to be working on log rolling. But as I have only one set of hands, it's going to be a little bit iffy to the extent of which I can perform these skills, but we'll get through it because we are Spartans. So, I meant to say we are farmers. So, what we're going to do is first things first, when we get into a patient's room, before I do anything, I'm going to verify the doctor's orders. I'm going to gather the necessary equipment and supplies to perform this task and perform hand hygiene. I'm going to provide for patient privacy. I'm going to introduce myself to your patient. Hi, patient. I'm Scott. I'll be your nurse today.
Patient.
Could you do me a favor and tell me your name and date of birth, please?
My name is Lovely Assistant. I was born on January 1st, 2020.
Fantastic. Thank you, lovely assistant. After doing that, I will perform hand hygiene. I will also put on gloves and make sure that all that stuff is good to go. After that, I'm going to explain the procedure. So today, we're going to be moving you up in bed because you are too far down. We don't want anything happening to you down there. We don't want you to fall off the bed or get hurt in any way. So I will lower the side rail. I will lower that side rail, pretend there's a side rail, and there will be a second nurse or CNA or just medical personnel with me on this side to grab that side of the draw sheet. I will grab this side. I'll make sure the patient is completely secure, make sure they're good to go. I'll have them cross their arms on their chest, please and thank you. I will then grasp one side of the draw sheet. We're going to pretend that there's a nurse there, and they're going to grab that side of the... Sorry, my dog is in the way. Then we're going to, on three, move you up the bed. 1, 2, 3. In theory, that will shove him all the way up the bed to where he needs to be. After that is concluded, I'm not an English major for this reason. I'm going to raise the side rails. I'm going to place the call light within arm's reach. Call light, pretend is right there. Make sure that he knows how to use it. Make sure that everything he needs is within arm's reach. So phone, TV remote, hand cream, I guess. TV remote, just make sure everything is good to go. Then I will perform hand hygiene or water or whatever else is in this general vicinity. Make sure that's good to go. I will then move my gloves, dispose of them, dispose of any supplies that I used during this procedure, and document everything I did. For log rolling, which is another thing that I will need to learn how to do, I will again have another nurse on this side of the draw sheet. This time, however, I'll be using a small pillow, which we'll use this smallish towel to simulate a small pillow. Close your knees, please. Perfect. Again, having him cross his arms on his chest, like so. Perfect. Shh. I'm going to have another nurse on this side. We are going to put pillows on the sides of him if we need to, which there are some right there, but for the sake of time, we're not going to. But let's pretend he doesn't need them. And then together, the nurse and I are going to roll the patient up to where they need to be. And again, after that, simply do the closing protocols.